Ever since the cancellation of many organized sports at the beginning of the pandemic, all the way back in March of 2020, many parents and doctors have been concerned about the mental health of young athletes. Joining us this morning is Dr. Drew Watson, who's been researching this topic. Dr. Watson, thank you for joining us this morning.
Good morning. Thanks for having me.
Of course. Well, first of all, what has your research shown when it comes to young athletes' mental health?
Well, I'd say I'm fortunate to work with a fantastic group of collaborators here at Wisconsin. And over the last couple of years, we've really been looking at how COVID-19 and the loss of sports impacts the health of young athletes. And I think what we found over the course of that time is that early in the pandemic, adolescent athletes across the country were reporting startlingly high levels of anxiety and depression. Here at home in Wisconsin, we found that our adolescent athletes were reporting levels of depression that were more than 3 times higher than what we'd see in the years leading up to the pandemic. But fortunately, those athletes who've been able to return to sports in the fall of 2020 reported marked improvements in anxiety, depression, quality of life, and physical activity. So I think overall, what we're showing is that losing access to sports has really negative impacts for kids, but the opportunity to return to sports appears to have significant physical and mental health benefits.
Right, that return is going to be huge, especially this fall. So what makes this topic so important?
Well, I think it's important to have a little context. We were in the midst of a mental health epidemic before COVID-19. We'd seen rising suicide rates among 10 to 24-year-olds for over a decade before 2020. And in the last few weeks, we've seen the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry declare a mental health emergency in children based on rising emergency department visits for mental health crises and suicide attempts. So this is obviously a really big issue for adolescents in general. And what I think we're showing is that the opportunity to be physically active and participate in sports can be one way to help kids with anxiety and depression.
Most definitely. So what can parents do if they think their kids are struggling and they don't have that athletic, outpost?
Well, I think there are lots of ways that kids can be physically active. And I would really kind of maybe answer that 2 ways. One is I think that we have to recognize how challenging and how complicated and difficult these decisions have been for families throughout COVID-19 regarding sport participation, and that we really should be supportive of any given family's decision about how and when and if their children participate in sports. But from a broader perspective, I also think we have to recognize that we need to be looking at ways to prioritize and fund the sort of programming that increases access for all children. We've seen, particularly among our research, that female athletes, athletes from racial minority groups, athletes from lower socioeconomic areas have had disproportionate impacts during COVID-19. And these have been traditionally underserved groups of children in the past. So as we're kind of imagining how we emerge from the pandemic, thinking about ways that we can fund programs and the structure that supports increasing access for these groups and for facilitating physical activity and sport participation for all children should really be a way that we can think that we can improve physical and mental health for kids across the country.
A really important point there. Dr. Watson, thank you for joining us this morning.